Well,
okay,
that's a plug for milk.
we've actually got 3 callers now, so we better start taking some callers.
Hello?
Hi, you're on the air.
Yes, I know you were just explaining the salt connection, but I want to get a little more clear on that because so many doctors seem to think that salt is just the worst thing in the world, and especially if you have high blood pressure. And recently I had a situation, well, I'm a bit overweight, and my blood pressure was high. Now I'm on medication that takes care of that. It's pretty mild. It doesn't have side effects. But I've always liked salt, kind of had a craving for it. And I had atrial fibrillation recently, which it turned out was related to suddenly I'd had a overactive thyroid, and I'm taking treatments for that to try to balance everything out. But the cardiologist thought that I should eat, practically cut out salt because she thought that that would help me lose weight and bring my blood pressure down, and that the blood pressure could aggravate the atrial fibrillation. Although it's interesting that weight doesn't seem to have anything to do with atrial fibrillation like it does other kinds of heart disease. So I haven't had an atrial fibrillation attack since I've been dealing with the thyroid, balancing it out. But in the meantime, I'm wondering about the salt thing. I mean, my blood pressure seems to be controlled with the medication. Is there any advantage to cutting back on salt for me?
Dr. P.
The hypothyroidism causes you to lose sodium, and it's probably the main cause of people having high aldosterone. And once you have high aldosterone because of low thyroid or low calcium.
Well, I had hyperthyroid. I had an overactive thyroid, and now they're getting it under control.
That's often a diagnosis, but it's often doubtful how factual the diagnosis is, because stress will cause your TSH to give an indication of hyperthyroidism, and the high stress hormones can give you many of the symptoms of hypothyroidism, but those can very often be cured by a supplement of thyroid. And
I'm actually taking thyroid now to balance me out.
Did you have a treatment?
Yes, I had the radioiodine treatment to shrink my thyroid, so now it's down. It's producing less than it should be, and I'm just about at the end of the shrinkage, and so now they've got me on 88 micrograms of thyroid to balance it out so I don't produce less, because producing more can be really dangerous, too.
Increased blood viscosity is a major thing causing the rhythm problems, atrial fibrillation.
Well, they got me on a blood thinner and a blood and a heart regulator.
Thyroid, by making you able to regulate your minerals, thins the blood, and it makes it easier for your heart to pump the blood by lowering the viscosity and regulating the minerals to maintain the right volume of blood at the right viscosity. So investigating your thyroid function in more detail, you might not need the blood thinner, because thyroid is probably the basic thing that keeps the blood viscosity low. And hypothyroidism is extremely common as a cause of hypertension, and that involves increased aldosterone, and that will create the appearance of so-called salt sensitivity. A calcium deficiency and low thyroid function make you actually sensitive to salt, so that you can raise your blood pressure by taking salt.
Well, now I'm getting my thyroid balanced to where it's supposed to be. So you're saying that will thin my blood naturally. They're hoping that will occur. But where does the salt fit in? Can I have a normal amount of salt without worrying about it?
If your calcium intake is well over 1,000 milligrams per day, and your vitamin D is good, then there's very little likelihood that you will be one of those salt-sensitive people.
Okay, because I am taking a good amount of vitamin D. I've been tested, and I don't have a shortage of vitamin D, which most people apparently do. And, calcium. How much calcium do I need again?
1,000 or 2,000 milligrams.
Okay. All right, well, thank you. I'll let somebody else have a turn. Thank you very much.
Okay, thank you for your call.